Good evening, everyone. My name is Pannavach Sriworasuwat. I'm a fifth-year medical student from Chulalongkorn University. Today, I proudly present you the clinical research called Suicidal Attempts and Self-Poisoning, one-year retrospective cohort study from the Quaternary Hospital in Thai Metropolitan area. Suicide is a big concern worldwide. Looking closely at Thailand, suicide is the fourth leading cause of death among middle-aged adults in Thailand. Knowing characteristics of at-risk patients will be helpful for policy making or designing a tailor-made management. However, there are several differences in social and cultural contexts within the country, where Bangkok might be different from the other provinces. Self-poisoning is common in big cities like Bangkok, but other characteristics of patients were still unknown. So, our study aimed to describe the characteristics of patients visiting the emergency department with suicidal attempt by self-poisoning in Bangkok. Our study is a retrospective cohort study. We collected data from patients attending emergency department with self-poisoning suicidal attempt from January to December 2021. A repeated suicidal attempt was counted as a separate occasion. The collected data are listed here. Outcomes were determined by a toxicologist using a standard poison severity score. The severity was graded as none, minor, moderate, severe, and fatal. This is how the score looks like. For the statistical analysis, we used SPSS version 22.0 software and reported data with descriptive statistics. To assess association between repeated attempts, we use univariate logistic regression, and then for the significant variables, we then analyze them with multivariable analysis. Let's get into the results part. During the time of study, self-poisoning accounted for 34.8% of suicidal-related psychiatric consultations. The demographic data, about 81% of them were female, with a median age of 22. Most patients had underlying psychiatric illnesses, and major depressive disorder was the most prevalent. Meanwhile, unspecified cluster B personality and post-traumatic stress disorder were the most common psychiatric comorbidities. The rate of overdose was highest in March, consistent with total and any psychiatric consultation from the emergency department. For the characteristics of the presentation, the median time to hospital was quite early, and they are usually come in the evening shift. For patients undergoing psychiatric treatments, the median time from the last appointment was 8 days, and the earliest time of repeated suicide was as early as the same day with the last follow-up. Most of the attempts were graded asymptomatic to mild severity upon presentation and final outcome. For the use of substances, we found that 91% of them were pharmaceutical agents, and acetaminophen was the leading substance for patients without any previous psychiatric diagnosis. Teenagers and young adults aged 11 to 30 years old were self-poisoned by the wider range of substances. For the repeated self-poisoning, we analyzed for the factor associated with them, and we found that female gender, previous psychiatric diagnosis, personality comorbidity, previous suicidal attempts, and history of follow-ups were significant by univariable regression, but only personality comorbidity was found significant using multivariable analysis. Let's get into the discussion part. We found that females aged 11 to 30 years old was the most prevalent group, while other parts of Thailand show an age range of around 30 to 50 years old. Pharmaceutical agents were used, resulting in mild symptoms with complete recovery, in contrary to agricultural substances used by the rest of the country. As I mentioned before, the rate of overdose was highest in March. And since our study site was a university hospital located next to the main campus, students took a great proportion of patients, and March was a period between exams. So this might explain a peak stress among students in this period. We believe that age distribution, urbanization, socioeconomic status, access to healthcare, and access to more toxic substances might be the reason of the significant difference. Also, our study still has room for improvement because this study might be subject to selection bias in which patients with prior follow-ups or more severe cases were more likely to visit our institute. Also, self-poisoning episodes that do not lead to hospital attendance or attempts resulting in death were not included. Let's conclude what our research have found so far. Since we found that reattempting suicides mostly occur within a week, and they were strongly associated with personality comorbidity. So, preventive efforts need to target the period close to the discharge from hospital. Also, identifying an at-risk population and providing specific intervention are worth investing in, because self-poisoning in this group is a strong predictor for the subsequent suicide and premature death. Thank you.
Such an impressive work. Do you have any comments or any questions?
I have a question that you mentioned maybe in March is related to students. Actually, how many students were there in the group, and if you compare, is it significance value?
Since I mentioned before that there are some data that we collected, but unfortunately we didn't collect that whether the patients are students or other occupation. So this might be an opportunity for the future research to identify that is it really true that patients in March are mostly students?
Can you explain more about the one risk factor that you found, the personality comorbidity? What are they?
Okay, since I said before that, firstly we assess the association by the univariate logistic regression, and then we found 5 factors that were significant. Then we put these 5 factors into a multi-variable analysis to find a correlation between these 5 factors. And we found that only one factor was found significant by the multivariable analysis, which is personality comorbidity, like cluster A, or which the personality comorbidity is a huge word. It includes cluster A, cluster B, cluster C personality.
Can you explain that to me? Because I just want to know what are they? The disease or which comorbidities?
Our study identified that personality comorbidity has a significant correlation with repeated self-poisoning, but unfortunately we didn't specify which type of personality comorbidity, like a huge umbrella word. Thank you.
I think that's important because you found it is the only risk factor. So if you can look more which comorbidities that, for example, like asthma or some other thing that you can, I don't know which personality, I don't quite understand, but which type of personality or something like that, so we can go into preventive measures.
Is it like obsessive compulsive personality or something like that? Like, or maybe if you say that, then also like Ajahn said, in the future we can prevent that, like can be the application of your research work. Yeah.
Thank you so much.
And I think, also because your study is only the patient that comes to the emergency department, right? And I think, we also like known that the one that, coming to the ER is, and the result will gonna be like unsuccessful suicidal attempt. But the one that, the successful one is not, they are not coming to the ER, right? And that one may be the burden of the problem that we would like to know. So maybe, the next or the further research, you need to look deeply in the detail, like the personality that, may be related to the suicidal attempt. And you can do like further research to the another one, another population that, successful.
Thank you so much for the suggestion.
Thank you very much.